Hey, good afternoon, Alaska. This is our first presser regarding the coronavirus in some time, as you know. And there's a lot to report on. There's a lot to talk about. So we're going to talk a little history with regard to this pandemic and how it's impacted this country and how it's impacted Alaska. We're also going to talk about numbers. What do our numbers look like now? Where are they going? And we want to talk about the future. And again, some of the things that we can do as Alaskans, as individual Alaskans, as entities, on being able to impact the spread of this virus. Today we're going to have Dr. Zink with us, Commissioner Crum, Commissioner Ledbetter, Commissioner Anderson, Director Heidi Hedberg, and AHSC CEO Brian Butcher. There's a number of things we have to talk about. There's a number of actions that are occurring. There's some parts of some bills that are sunsetting. So we're going to talk about the virus, the cases, the health aspect. We're also going to talk about some of the actions that the legislature had done to assist with dealing with this pandemic for the people of Alaska. We're going to talk about some of the programs. And again, like I said, we'll talk about where we think things are headed and where we would hope things will go and how, once again, we can assist with making that happen. So I'm going to run through, like I always start, talk about some of the numbers. And new cases in state. These are in-state cases, 36 for a total of 940 cases. No new deaths. We still stand at 14. Cumulative hospitalization has been 67 over time. Total recovered, 526. Total tests given, 112,185. And so we're just going to talk a little bit about history just to refresh everybody's memory, because we do this almost on a daily basis. Where are we? Where were we? Where do we think we're going? Because we're trying to figure this whole virus out, the course that it has taken, the course it looks like it's going, how it impacted other parts of the world, how it's impacted the United States, what it's doing here in Alaska. So as you remember, for some time, our cases were very, very low. When I mean low is 3, 5, we'd go up to 12, then go back down to 3. We'd have 0. A couple of times we had 0 cases or 1 case. And so Alaska's cases were, what some of us would term surprisingly low. We just, in some ways, we couldn't figure it out. We thought it's probably the fact that we're disconnected from the rest of the country, small population spread out, whole host of things I'm sure contributed to it. But nonetheless, we knew that the time the cases were low. If you remember, if any of you follow this since we began this process way back in February, we always said that the virus was going to come to Alaska. It's a highly contagious virus. Even today, what we know is this. It is a highly contagious virus, meaning it easily moves from one person to the next, and that's how it survives, that's how it replicates, and nothing has changed on that. If anything, the last several months have confirmed that. You see, you hear what's happening down in the lower 48 with numbers rising again. Numbers are rising all across the world, places like South America, India, Asia. Some of the places that really, would report at times that they thought they had it under control, some of the places in Asia, reporting new cases as well. And the reason for that, again, it's a highly contagious virus. That's what we know. We know it jumps from person to person. We know that. We know that staying away from others makes it more difficult for this virus to move from person to person. You know, one way to look at it is if we all stood apart 10 feet or more on the globe for 14, 15 days, this virus would disappear because it doesn't have a new host to go to. So that's what we know. We also know that they're working feverishly on a vaccination. We don't know what the outcomes will be on that vaccination. No one's really sure. We don't know how effective it will be. We don't know when it's going to come into mass production. So we're still watching that like everybody else. We're also anticipating that they continue their work on antivirals or treatments for once you get the virus to minimize the symptoms and minimize the effects of the virus so that folks can get through the recovery process a little bit better, a little bit easier. What we do know, and we still know about Alaska, is our numbers in many respects, most respects actually, are still very, very low. Our cases have gone up. And there's a couple of reasons we believe that's happened. One is certainly our testing has gone up. However, we do believe that the virus is spreading in Alaska. with more mixing, with more folks getting out. Again, it's just understandable that this is going to happen. We never said that we were not going to have the virus in Alaska. If you look at some of the previous press conferences, especially months ago, understanding it once again that it was highly contagious, we knew it was going to come here. If you remember what the goal was in the beginning, was to ask Alaskans to help us buy time so we could stand up our healthcare systems, so we could add more bed capacity. You remember the earlier conversations about ventilators. We need ventilators. We need PPE, the personal protection equipment. We need the beds. We need to get people prepared. And Alaskans did a tremendous job. A tremendous job. In my opinion, looking at the numbers and talking with others, probably the best in the country. And we're still there. But we also said the numbers would grow. And then once society started to open up again, more and more, businesses, entities, people mixing again, we said that the numbers would go up because we know that this is a highly contagious virus. But our death rates have still stayed pretty low. Our hospitalization rates are still fairly low. Those in ICU, low. For example, as of today, there's 3 positive patients with the virus in a hospital. There's 1 patient on a ventilator. We have 245 ventilators available. So our equipment, ventilators, bed capacity are still in really good shape. I know that we're reading about some of the things that are happening in the lower 48 and some of the states. That's not occurred yet here. Our hospitalization rate, this is an interesting number. Our hospitalization rate in Alaska as a result of this virus is 9 for every 100,000 people. We compare that with the national rate of hospitalization. National average across the country is 98 per 100,000 people. We're not sure what the answer is. I'm sure there'll be some questions for Doctors Inc. To try and guess why that's happening. We also have the lowest transmission rate in the U.S., and Doctors Inc. will talk about that, meaning we test a lot. We're at about number 6th in the nation in terms of where we rank in the number of tests. At the same time, what we're finding is when we administer those tests and the results come back, we have one of the lowest positivity rates in the country as well. Sixth highest testing per capita in the country. So numbers are growing. We said that. We have more mixing. We have travel. We have folks coming in from outside to work in Alaska. Our rates our positives are going up. We knew that. Our death rates are still at 14. Our hospitalizations, low. Number of folks on ventilators, like we said, 1. Our ICU capacity is still really, really good. So what this means is that we continually watch this every single day. I give our health team a lot of credit. I give our folks working on this issue, not just in our administration, but across the state, cities, other entities. This has been a slog. I mean, it's been the virus every day for all of us. But we stay on this. We continually discuss this issue. We're looking at new data every day. We're talking with folks across the country. We're talking with some of the best minds that there are, trying to understand where this may go, what are some of the twists and turns, and how it's going to impact Alaska. So when you read in the newspaper or you see on the news that the cases are going up, they are going up. But I would say this, nothing surprises us so far. And when I say nothing is alarming, what I mean by that, and I need to clarify because I don't want anyone to misunderstand what we're saying. This whole pandemic, in essence, is alarming. It's concerning. And but what we're saying is our metrics that we're looking at, they're still holding. Certainly if the numbers keep climbing, and certainly if there is a steep incline, the math would dictate that we should see more hospitalizations. Unfortunately, we should see more deaths. Is this something we want? Of course not. It's not. But what we've tried to do here the past several weeks, actually the past couple months, is try and come up with a balance where we can get society moving forward, we can get our businesses moving forward, and have a balance where we can keep our case rate low, relatively speaking, certainly keep people out of the hospital to the extent possible, and certainly do everything we can to minimize folks passing away from this. The folks that were really affected by this and impacted, and the folks that passed away, many of those folks fall in that category of having some health issues to begin with, being older, falling in the category that we've talked about consistently throughout our press conferences. Younger folks, the vast majority of Alaskans, 85%, even higher, just like in the lower 48, many of them don't even know they have the virus. Some that do, it's mild, and there's a progression. But for the most part, this virus, although highly contagious, is not impacting the vast majority of the population. What it seems to be doing is concentrating the worst effects on those that have underlying health conditions and are older. That hasn't changed. Remember, when we first started to talk about this, we were very concerned on how it would impact children. And if it did impact children, in a manner that was first speculated that it could, that would have been a devastating blow, I think, to all of us. And it would have had us, probably had us acting very, very, very differently. It doesn't mean we haven't acted differently because of the population it does, in fact, impact. We had an outbreak or two several weeks ago in some of our elder care and senior homes. As we mentioned, when we see this happen, when we see these clusters and see these spikes, we're going to immediately deal with those. And that's what our health teams did across the state of Alaska. And so you don't hear much today about what's, cases inside those senior care centers and elder care centers because, again, when we saw something erupt, we got in there, we worked on it. What you're seeing now is what they call spread in various communities because of the mixing again. So what you're going to hear me ask you, Alaskans, is we have businesses up and running. We're getting our economy going again. Many of us are getting back to a semblance of the life we once knew. But this virus, because of how contagious it is not going to let us get back fully to where we were. And that's going to be part of the discussion tonight after we go through the stats and the data with the folks online here to help us out and answer some questions. There's been a lot of talk about masks, just like there were ventilators early on. And a lot of good discussions. Early on, you had officials nationwide that were, to some degree, dissuading folks from wearing masks. Part of that, people think, was the fact that there wasn't a lot of PPE. And another part of that was they just weren't sure, given the nature of this virus, if that was going to slow it down. But more and more and more, the evidence appears that if you limit your projection, just like when we were kids, right? If we sneezed or coughed, our parents would say, cover our face. It's almost elementary. Cover our face. Well, why would we do that? Why would we do that if it doesn't matter? Why would we do that if limiting a projection doesn't matter? But I think most health professionals and most medical professionals, scientists that are looking at this today would say, if you can limit your projection, your cough, your voice, your sneezing, that means that you help. Nobody's saying it's the cure-all by any stretch of the imagination. But many people would say, and many of the professionals would say it helps, and it's one of the tools in minimizing the spread to the extent possible. What we're also finding is more and more as time goes on, if you're outside, that helps minimize the spread. If you're in a small contained room with not a lot of air circulation, with a number of people, you increase your risk. So it's really a risk game, it's a math game, it's an average game. If you want to minimize your risk, and if you want to minimize the risk to others, and I think that's really going to be a central topic tonight because we're going to go into the 4th of July weekend. It's supposed to get really hot, which is terrific. I don't know about you, I don't like it too hot, but it's nice to have it hot every once in a while in the state of Alaska. But as we go into this over the weekend, there's going to be a lot of get-togethers. And I'm going to ask you now, and I'll ask you at the end of this broadcast, I don't want to say don't get complacent, but I want to just remind folks that the virus is real, it's alive, and it's spreading. Again, the vast majority of people, it's not a life-threatening event for the vast majority of people, but it is for a percent of our population. And I would just ask people to, if they can, and I'll do this over and over again, if you can put some distance between you and others, I strongly suggest you do that. And that's based upon, once again, medical experts. This virus lives from hopping to another person. If you can put some distance between yourselves, whether you're having a barbecue, whether you're out fishing, if you can put some distance between yourself, you help. You help yourself, but you help others. If I go to a store, I'm going to cover my face. If I go to an enclosed area, I'm going to do my best to cover my face. There will be times, like you, I've been caught without the face covering. I'm going to minimize that. I'm going to work hard at minimizing that. And I know that the whole concept of a mask and face coverings is becoming somewhat politicized. And it shouldn't have to be that way. And I'd hope it's not that way. But again, I go back to what my parents taught me and what your parents probably taught you. If you're going to cough or sneeze, cover your face. Well, now with this highly contagious virus, more contagious than many others, if you can wear a face covering when you go into a store, I just want to leave you with a thought. Next to you may be an individual that is going to go home to a child that might be undergoing cancer treatments. Next to you over here might be a young man that's going to go home to his elderly parents. He's coming out to get food at the grocery. He's coming out to a hardware store to get supplies to fix something in the house. But at home, he's got elderly parents. And, I'm not going to argue that individuals themselves have a responsibility to take care of their health. We do. Our role with the state was to build up our system, our healthcare capacity, and make sure that system is ready to take on folks that are going to get sick. And we're feeling pretty good about that. Once we get Heidi on here talking about PPE and some of the other things that we have, you'll see that we have right now the equipment, the facilities, and the gowns and so forth. But nonetheless, what I'm asking Alaskans to do is just think that everybody around you, especially in a situation where you don't know where the people are, stores, those types of settings, that you may have folks in there that have to go to those stores to get something to eat. And that they may be going home to individuals that fall in that category that you or I may not fall in. And they're coming to those stores oftentimes worried about what they're going to encounter. They're coming to those situations concerned about what they're going to encounter. And I'm just asking, especially with this weekend coming up, that we show not just ourselves, but again, we show this country that Alaskans can think of others as we think of ourselves, as we're thinking of ourselves, that we think of others. And if we can do our best, we'll keep these numbers at a certain level, and we're going to get through this process, as we've said, for months. So with that, we're going to go in just a minute to Dr. Zink. We're going to talk about the CARES Act as well. We're going to talk about what's happening with HFC and a few other things. So with that, Dr. Zink, if you want to take some time, explain the numbers and anything else that you have to say regarding where we're at right now with the virus here in the state of Alaska.
Great, I appreciate it. Thanks so much, Governor, and thanks to all Alaskans. I know that many people have been tuning in other forums, and it's nice to speak with you all tonight. A couple slides and data for you. So again, going to the dashboard, people may have been seeing changes on the dashboard. We continue to try to update this on a regular basis. The governor did mention that we have 36 resident cases today. We also have 12 non-resident cases for a total of 46 cases. 21 are in Anchorage, 5 in Fairbanks, 4 in Seward, 2 in Palmer, 1 Eagle River, 1 Juneau, 1 Soldotna, 1 Valdez. And if we go on to the next slide, just a few more data points for everyone. You can see that cases are really picking up across the country. You can see in the United States normalized by population compared to other countries. We're really on an upswing again. The reason this is important to Alaskans is it really affects some of our turnaround times for some of our commercial labs, other resources. as well as when we're thinking about travel. So we continue to watch what's happening across the globe as well as the United States. And on the other slide, you can see Alaska compared to other states. So as the governor mentioned, while we do see a significant increase in cases here in the state, we are in a much better place than many of our colleagues in the lower 48 that we talk to on a regular basis. This is all public data and can be seen every day. Moving on to the next dashboard, again, these were the four major things that we track every day: the disease activity, testing capacity, public health capacity, and healthcare capacity. And so just going to go through each of those four. So moving on to the next slide. So our disease activity, our epidemiology, this unfortunately has changed from kind of a green to a yellow. It's a little bit more caution now for a couple different reasons. It's kind of been three kind of distinct little wavelets that we've had associated with our epidemiology here with the cases. The first one, we had first cases here. We really didn't have much testing. We didn't have much healthcare capacity. We were learning a lot about the disease and the process. Initially, everyone really hunkered down. Alaskans brought that curve really very, very low, and we had very few cases there for quite a while. And you can see that in that time, we spent a lot of time building up healthcare capacity, testing, pre-testing, prior to procedures, travel, getting ready for our fishing industry. And then we started to have this kind of increase in additional cases. A lot of that was driven by two major factors. One was the transitional care facility in Anchorage, quite a few cases associated with that. And then down on the Kenai Peninsula, particularly around some family gatherings and other celebratory gatherings associated with Memorial Day. And as those kind of outbreaks started to burn themselves out, we started to kind of come down a little bit. Our R0 came below 1 there. But what happened in that process is a bunch of small outbreaks kind of seeded across the state. And so now we have small outbreaks in numerous places across the state. And what we're really noticing is that instead of people having 1 contact or 5 contacts, when we talk to someone, they'll have 20 contacts, 40 contacts, more contacts than they can identify. They may have traveled numerous places throughout the state. We really appreciate when people are open and transparent about those cases. There's nothing to be ashamed about with COVID. The sooner we identify it and the sooner you share it with family, friends, or local establishments you've been in, the quicker we can really settle down these cases and keep it from growing very, very quickly across the state. Again, the goal is not to spread the disease quickly across the state. We have many diseases, smallpox being an example where it never got herd immunity. We get herd immunity best by having a vaccine. There's a lot to learn about this disease. There are long-term side effects, and every day we get closer with more treatment and more vaccine options. And so the more we can kind of keep a lid on COVID, the better off we're all going to be. So really, we're entering into this kind of third phase where we're seeing a lot of cases diffusely. Just over the past weekend, we had 7 cases in 7 different bars that had tested positive with a lot of outbreaks. And bars right now are really high risk activity. And so if you do attend a bar, particularly indoors, know that that's a high risk activity and you really need to minimize your contact with others, particularly those who are vulnerable for the next 14 days afterwards. We're just seeing more and more outbreaks associated with that. Moving on to the next slide. We're trying to provide more transparent data that's in real time and moving. So you will see, hopefully on the website later today or tomorrow, there will be this table, and then eventually it will also be in a picture where you can see new case count average over the past 14 days per 100,000 people. We needed to make sure those regions were big enough that it was somewhat statistically valid. And so each of the regions are based on the 1115 behavioral health regions that has to do with people and where they tend to move, and each region has greater than 20,000 people, which was important for statistics. And so you can see that right now the Kenai Peninsula has 3.9 average new cases per 100,000 people average over the past 14 days, followed by Fairbanks, Anchorage. Statewide, we have about 2.4, and then you can see the rest of the regions on there. This will be information that will be updated daily and will be on our website as well, so people can see kind of your region and what the outbreak looks like across your region. This is very similar to what is followed in the lower 48. Some places have average over 14 days, some at 3 days, some it's a week. We chose 14 days in Alaska because of our large geographic variance and our small patient population and small overall population to make sure it's a little bit more statistically accurate. Moving on to the next slide, testing. Testing still remains in the green category. As the governor just mentioned, we are the 6th most tested state in the country, and we do have the lowest % positivity rate in the country. So those are good things to see, and appreciate a lot of time and work that people and partners across the state have put into that. That trend is going up slightly, though. We have started to trend upward on a % positivity rate, and we are now at 1.5% of our tests are coming back positive. Our lowest was back in the end of May, about 0.15, and our highest was back in April, about 4% positive. These are very different numbers than you see in the lower 48. That being said, some of our regions have really good access to testing, and some are really limited. We're still having really long waits, say at the Anchorage drive-through. So working closely with them to try to make that more efficient and offer more testing options. There's also numerous at-home testing options now that people can order themselves, and we're seeing really good 24, 48-hour turnaround time associated with those. So know there's a lot of commercial options out there available as well for at-home testing. And the sooner you get tested at the beginning of your symptoms, the more useful that test is. So if you're starting to have any symptoms, that's when the test is the most useful. Moving on to the next slide, contact tracing. This one unfortunately has slipped into the yellow range as well. The way that we do contact tracing is a person gets identified as being positive, the laboratory notifies the provider notifies the patient, and then it's a reportable disease and notifies us. As these contacts have grown, it's harder and harder to contact all of the contacts. And so we're having to make more general announcements as part of the reason for just letting people know now. The more you can keep track of your contacts over the last week, really ideally over the last 2 weeks, depending on when your infectious period started, the better off. And the smaller you can keep those circles. We really see young people driving a lot of the cases in the lower 48 as well as here. Young people tend to do well. However, it usually takes 1 to 2 cycles for that to then get into an older, more vulnerable population. Maybe they work at a long-term care facility. Maybe they live with their mother. Maybe they then hang out with someone else at a restaurant or bar who then does have that same sort of work process. And then it spreads into higher risk settings such as long-term care facilities, nursing homes, elderly population. And that's where we really see the mortality increase as well as the hospitalization rate. We've been very fortunate in this state that we've only really had one major outbreak in the transitional care facility and have not seen it in other ones. But that could very quickly change and how quickly that one spread. And so that's why I really ask young people, you are really the ones who get to make a huge difference right now. And so really keeping your circle small and outside makes a big difference in minimizing the spread of this disease. Moving on to the next slide, hospital capacity. Again, here are our vents, our ICU beds. You'll see this number on the dashboard, and it's COVID patients plus persons under investigations. They're waiting for lab results to come back. And you'll see a lot of fluctuation with that as testing comes back at different times at different hospitals. This information is reported to us from the Hospital Association. And so we always have to keep going back and making sure that the data is as clean as possible. As mentioned previously by the governor, 3 people in the hospital right now, 1 in the ICU. I think it's also important to note that these inpatient beds also include behavioral health beds, OB beds, other beds that ideally we would not be using for COVID patients. And so working with the Hospital Association to even provide more data on this dashboard so people can see what that looks like. It's important to know that Alaska really does have limited healthcare capacity. And while we do have a lot of vents and ICU beds, Anchorage hospitals tend to be our big kind of hub for a lot of these. They're running at about 80% capacity right now. And the flu season, RSV, it is not uncommon for us to get near or above capacity. If you've ever had to wait in the emergency department to be admitted to the hospital, you know what I'm talking about. Unfortunately, our hospitals do run at high capacity. And we are working with them as well as our alternative care sites to have continued backups. So with that last slide, really these things make a huge difference. We've seen and been able to learn that we really can care for COVID patients safely, that we can keep a lid on COVID, and that we can really keep it from spreading rapidly while keeping businesses open and people connected. But it takes all of us. And so that's really doing those basic things, really washing your hands, staying 6 feet apart from others, wearing a mask or a face covering whenever you are near others, particularly inside, keeping your circle small, and getting tested at the earliest signs of symptoms. So with that, I appreciate it, and I'll hand it back over.
Thanks, Doctor. So we're going to go to Heidi Hedberg. Heidi is she's our logistics person. She's the one that will help secure the testing, the PPE equipment, help set up, for example, the airline center, assist with those off-location type of hospital units as well. So just going to give her a few minutes. But Heidi, if you want to just update us on some of the testing and where we are with some of our equipment, that would be helpful.
Great. Thank you so much, Governor. So I wanted to just talk first about personal protective equipment. So as many of you heard and saw, back in February, March, April, the hospitals, the healthcare settings were having a really difficult time getting personal protective equipment. And there was definitely some supply chain issues because of the high demand. And so what we did was we continued to work with the commercial sector. We look to you, Alaskans, to the manufacturing in Alaska. What can you manufacture in Alaska? And we turned to our federal partners. How can you support us in our time of need? And so through those three different areas, what we saw was that we were able to meet the personal protective equipment needs. It was hard in the beginning, and we were able to really increase our quantities to the point where at the end of June, we have a stable supply of personal protective equipment. What we have seen over the last 4 to 6 weeks is that the commercial lines are really opening up. What we are seeing is that healthcare providers, hospitals are able to start to secure their own personal protective equipment. It is our job to always maintain that cash as a contingency to make sure that we're able to meet surge events, but we have a stable supply of personal protective equipment. I want to follow on and just talk a little bit about when Health Mandate 10 was revised, we had a new initiative, and that was revising the travel declaration form and working with the 10 airports and the travelers that were coming into Alaska and setting up a screening and testing. And we worked with those 10 airports in addition to the 3 communities that have border crossings. And just as a reminder, for land crossings, it's for essential workers only or folks returning to Alaska. So the numbers are very low crossing the border. And then again, with our communities that have seaports where they have private vessels that are coming up on a vacation. And so we've worked with those communities to really focus in on the travel declaration forms, which is a screening tool, and the testing strategy. And so I just wanted to share with you, over the last 3 weeks, what we have seen is there has been an increase in travelers that are screened. Over the last 3 weeks, what we have seen is that there's been a significant increase in travelers getting tested before they travel to Alaska. This is good news. We're excited to see that our message is getting out, that travelers are getting tested before they arrive in Alaska. And we've seen a steady number. We're averaging, around 4,500 to 5,000 last week of travelers getting tested at the airport. We are seeing fluctuation with a 14-day quarantine. It was below 500. It was then below 2,000. And then last week it was below 1,000. So it has been fluctuating. And then through this initiative, what we have been able to do is identify 45 positive cases. And that's really, as we call it, boxing it in to make sure that they go into isolation and recover through COVID and then continue on their work. So the strategy has been working at the airports and in partnership with the communities. So I'm thankful for that. Thanks, Governor.
Thanks, Heidi. And Heidi, all the folks will be available for questions here as soon as we get through the first part of this press conference. So this press conference is going to be a little longer than usual. We want to go next to the Alaska CARES Act. And I'm just going to read off a few statistics. This has to do with the economy and assisting folks. And so we're going to have here in just a moment Commissioner Anderson talk about the CARES Act, and then Commissioner Ledbetter is going to talk about some unemployment issues, and then we'll wrap that part up with Brian Butcher with AHFC to talk about some of the programs that have been occurring over at AHFC. So with the Alaska CARES Act, about $5.5 million of grants are in the hands of local businesses. We have Credit Union One that's working and improving internal processes to make sure that this works. As previously announced, eligibility will expand in mid-July to businesses who received limited federal funds initially. Department of Commerce and Economic Development is working with local governments to set up local grant programs using the CARE money. And so with that, we're going to have Commissioner Anderson just talk in a little more detail as to what is occurring with the CARES Act. And again, when we open up for questions, Commissioner Anderson, as well as everybody else, will be here to be able to answer specific questions and fill in some details. So with that, Commissioner Anderson, if you could just talk for a few moments about the CARES Act and some of the highlights as to what's happening.
Thank you, Governor, and good afternoon. As the Governor stated, I'd like to provide an update on the CARES grant programs for small businesses and communities. As you may remember, the Governor's distribution plan for the Federal CARES Act funds included $568 million for communities and another $290 million for small business relief grants. The Department of Commerce partnered with ADA and, as the Governor mentioned, with Credit Union One to be able to get these funds out into the hands of small businesses as quickly as possible. To date, the Credit Union One has received over 2,000 applications totaling $85 million from businesses across the state. Of the approved applications, 27% are from rural areas and 73% from urban. These grants range from $5,000 to $100,000 and can be used for operating expenses incurred from March 11th to date of application, and will provide for payment of expenses 8 weeks from the date of application, which is approximately over 18 weeks of eligible expenses for these small businesses that suffered economic loss during this pandemic. I think that is incredible, and I urge people to apply for these funds as quickly as possible. To do that, please go to the Credit Union One website at cu1.org and review the video, which provides instructions on how to apply. It's only a 3-page application, and we want these funds to go as many small businesses that are eligible as quickly as possible. And all the program details are available on the Department of Commerce's website, Credit Union One's, and ADA's website. And the review process is taking a little longer than originally estimated. There's a high volume, and additionally, people, I think, were a bit confused about how to apply for some of the SBA funds, the 3P and the EIDL, versus this program. This program is a much simpler program to apply for. So if you follow the instructions, it's only a 3-page application. Applications are being processed on a first-come, first-served basis, and it's important to get your applications in as quickly as possible. Also, there are plenty of funds remaining, and we really want you to spread the word about this program. Tell your friends that happen to be small business owners or those small businesses that you frequent about this program, and they can always contact the Department of Commerce for more information. And as I indicated in an earlier press conference, the department is revising the program guidelines to allow more businesses to be eligible. We are currently working on updating these guidelines and expect these to be effective mid-July. We will post any changes to the program guidelines on the previously mentioned websites, and additionally, your local economic development organizations or ARDers, as well as Small Business Development Center, are available to help you apply for these funds. In regards to the Community Assistance Program, which is being administered by the Division of Community and Regional Affairs, it is going quite well. As of June 29th, 52% of the communities have received funding, and that equals $298 million of the $365 million that is available during this first round of funding. As you may remember, the community assistance payments are going out in 3 phases. And communities can use these funds to mitigate the impacts of this pandemic in a variety of ways, including assistance to individuals, to small businesses, to nonprofits, and others. So I urge you to contact your community leaders for more information on how they plan on distributing these funds. I know we have a lot of information to share today, so I will pass it back to the governor and wish all of you a very happy and safe 4th of July. Thank you.
Thanks, Commissioner. Again, Commissioner Anderson will be here for questions. We're going to go now to some unemployment statistics and information. So prior to the virus, the pandemic, our unemployment stats were some of the best in the state's history. We were below 6%. And according to some of the stats, we had unemployment as low as 5.2% before the pandemic hit in March. So that all changed in April because of the the closures, our unemployment went up to 13.5%. It's the worst ever. We had some of the best, turned around, some of the worst after that. We are slowly adding jobs. In April and May, we added 13,800 jobs. So our unemployment rate is coming down as we speak. We have a steady increase in hiring in healthcare, seafood, and service sectors. And our job center networks, we continue to see activities as employers are recruiting. The new pandemic unemployment assistance program is currently helping about 20,000 self-employed Alaskans. That's almost a third of all the Alaskans receiving benefits right now. And I just want to shout out, I want to once again say thank you to all of the staff that's been working through this pandemic. I also want to make sure that we include the Department of Labor in that. A lot of demands in the Department of Labor, obviously, for unemployment insurance, as well as Commissioner Anderson over the Department of Commerce and Economic Development for some of that CARES Act money. So with that, I'm going to turn it over to Commissioner Ledbetter just to talk about some of the unemployment stats and information that people may be interested in.
Thank you, Governor.
Excuse me. Your mic's on mute, Commissioner.
Can you hear me now, sir?
We can hear you loud and clear now.
Thank you so much. Good evening, everyone. And thank you, Governor, for the opportunity to inform Alaskans of our economic trends that we're seeing in light of the dramatic swings in unemployment over the last several months. Let me just start with a slither of good news. Things are finally starting to pick up. Overall, jobs are down significantly compared to this time last year. However, there was a large jump in new jobs from April to May of this year. In that short time frame, we added 15,700 jobs, bringing Alaska's total employment base to just under 294,000 jobs. We are still significantly down by about 40,000 jobs compared to May of 2019, but it is important to recognize that the economy is beginning to move in the right direction. In February, before the pandemic hit, Alaska experienced the lowest unemployment rate in the history of our state. Month over month, we saw widespread growth in private sector. Employment had fallen in the government sector, but oil, gas, healthcare, construction, all of these industries added hundreds of jobs. Now, I don't need to remind Alaskans of what happened next. COVID-19 disrupted businesses. Individual Alaskans all across the state were affected in dramatic ways. So since March 1st, approximately 60,000 Alaskans have received unemployment insurance benefits. Through a combination of federal and state funds, the unemployment program has paid out a total of $485 million, with approximately $65 million going to independent business owners. The Federal CARES Act allowed, for the very first time ever, unemployment insurance coverage for the self-employed. The combination of federal and state benefits has allowed many Alaskans to weather this difficult period. But it's important to note that the Federal CARES Act funding of $600 per week is scheduled to end on July 25th. For those Alaskans seeking employment or in need of job training and employment resources, I strongly encourage you to use the resources of the Alaska Job Center Network. The Department of Labor and Workforce Development's portal, Alaska Jobs, is available 24 hours a day, 7 days a week, and job seekers and employers can contact their nearest job center. Many are surprised to learn of the full range of employment and training services available and the funding opportunities that they can pursue in terms of looking for new career pathways. So again, I encourage you to use the tools available to you. Economic indicators are moving in the right direction, and I'm optimistic, but there's still a lot of work that needs to be done. And I want everyone to know that our team is pursuing all avenues in support of Alaskans. But let's be clear, there's no way to sugarcoat the reality of a canceled tourism season. But I do want to offer some hope. Our governor and each commissioner is doing everything possible to ensure that Alaskans get through the pandemic safely and that our economy is returned to the place of prosperity, sustainability, and economic growth. Thank you, Governor.
Thanks, Commissioner. And we're going to go to Brian Butcher in just a moment. I want to just hit on a few points regarding a bill, SB 241, that was passed by the legislature. This was a bill that had suspended a number of different things, such as student loans and repossessions of motor vehicles, as well as a moratorium on foreclosures and evictions. The purpose of the bill was to try and give Alaskans relief. Again, we're working with a lot of unknowns. We didn't know what this pandemic was going to do. We're still not sure of some of the twists and turns. But nonetheless, the legislature acted on a bill to try and give Alaskans a little bit of relief for a certain period of time. This bill, SB 241, is now, there's parts of it that are going to revert back to what the laws were. In other words, these suspensions are now sunsetting. Today is the last day for some of these, and I'll go through a list here, short list, of today, July 1st, what happens on July 1st, what happens on July 15th, and what is going to stay in place until November 15th. November 15th is when the emergency powers and declaration passed by the legislature will sunset. So for SB 241, and this expires today, and starting tomorrow, July 1st, today's the last day, the moratorium on evictions for non-payment of rent will end tomorrow. The moratorium on foreclosures will end tomorrow, July 1st. And the moratorium on repossession of motor vehicles, which includes cars, airplanes, watercraft, will also sunset tomorrow. So you just want to make sure that you're aware of this and just be prepared. On July 15th, what expires as part of this bill is the taxpayer deadline to file certain state taxes. This doesn't include property or oil gas related taxes, but certain property taxes. And you want to go to our website and check on that. And then what's still good until November 15th will be a moratorium on disconnection of residential utility services, a moratorium on default for certain state loan programs, student loans, ADA loans, and other Department of Commerce and Economic Development loan programs. So you want to, again, you want to go and take a look at SB 241, this bill, to get the details. But again, starting tomorrow, there are parts of this bill that will sunset. We're going to go to AHFC here and have Brian Butcher, who's the CEO of AHFC, talk about certain programs that AHFC is offering. So Alaska's Housing Relief Program provided up to $1,200 in rent mortgage assistance during this period. The AHFC Forbearance Program, available for single and multifamily homes, is in existence. And municipalities like Anchorage are using some of their CARES money to create new safety nets. And so we've directed HFC to create a $10 million relief program with the CARES money, and Brian will talk about that in just a moment. And so 22,000 Alaskans will benefit from these grants. There's going to be checks mailed in mid-July. And we'll ask Brian to highlight some of the details and hit upon some of the important parts of some of these programs that impact Alaskans. So Brian, if you could do that.
Yes, thank you, Governor. Just to reiterate real quickly, the HFC Alaska Housing Relief Program was set up with $10 million of care funds provided by you, Governor, to pay Alaska families up to $1,200 apiece that met the criteria, which was that they received reduced income as a result of the pandemic, as well as having it drop them below 80% of the median income in their community. The application period we had was open from Monday, June 15th, through Friday, June 26th, which is last Friday. And I'm happy to say that as a result of the applications in, every family that meets the criteria and put an application in will get this needed rental or mortgage relief. There were 8,025 applications submitted by the deadline from every corner of the state. Approximately 5,000 are renters, approximately 3,000 are homeowners. Of those that applied, the total household loss of income averages a little over $1,800 per month per household. So that's what we've seen them lose as a result of the economic impacts of the pandemic. Alaskans that have applied for the program will be contacted by a representative of AHFC to verify their primary residence and what their income is beginning tomorrow, although it will take a few weeks for us to contact all 8,000 applicants to get their details. And as a result, Alaskans who applied can check the status of their application and the placement on the list with a ballpark idea of when they will be being contacted by us at the same website that they applied, which is www.alaskahousingrelief.org, or by calling 833-440-0420. And I know sometimes it's not easy to write those down quickly, but that contact information you can also find on AHFC's website at ahfc.us. As a result of this program, as you mentioned, Governor, almost 22,000 Alaskans will be able to get rental or mortgage assistance as we continue to work through the economic challenges of this pandemic. And as you had mentioned, Senate Bill 241, Governor, about the moratorium on evictions and foreclosures that occurs after today, I'd like to let Alaskans know that there are more opportunities to work through forbearance, to not go into foreclosure with your mortgages if this is financially connected to the pandemic. Most of the mortgage holders in Alaska, which are mostly Fannie Mae, Freddie Mac, and about 20% of them are AHFC, we will work for a forbearance at least until August 31st, if not longer. And I think most all Alaskans, if you contact your mortgage servicer, you're going to be able to figure out where your mortgage is, but there is going to be a little bit more time to work through those, which is going to be beneficial for Alaskans. With that, I'd be happy to answer questions when we get to that time. Thanks for the time, Governor.
Thanks, Brian. And so, again, we'll have a whole bunch of folks here to be able to answer questions. So at this point, Jeff, we're going to open it up for questions, and we're going to take as many questions as possible and do our best to get the information out to Alaskans.
Okay, thank you, Governor. We're going to take our first question from R.B. Smith at the Nome Nugget. RB, are you on the line? Okay, we'll come back to RB if we hear from him later. Let's go to Michelle Easty at KCAM Radio in Glen Allen.
I just added that since he had already done it.
Hi. Yes, I was just wondering if you could talk a little bit about the testing happening at the airports, and do you feel like that is being effective, and expect to keep it in place for how long?
Yeah, good question. So I can have Heidi, if you're still online, to be able to address that, please.
Yeah, thanks for that question. So it is a really good strategy right now, and through the collaboration with our communities and the contractors, we are able to meet the needs of screening and testing at the airports. I think that it is working. We are getting a lot of feedback, and some of those comments, we're definitely taking back and refining the processes with our contractors. But yeah, it is working. Thank you.
Thanks.
Okay, for our next question, let's go to Margie Bauman at the Cordova Times.
Yeah, thank you, Jeff. What I'd like to know, either from Dr. Zink or whoever, is a couple of questions here. How high do you expect these numbers to go of positive cases? Do you have any idea? And on the seafood workers, how are you, as the state, tracking seafood workers confined in quarantine? Who's monitoring them? How often are they being tested? Are they being transported out of coastal communities to Anchorage or monitored in place? Thank you very much.
Thanks, Margie. So, yeah, Dr. Zink and Heidi, if you want to tackle that one, we were having that discussion today, as a matter of fact. Or, Adam, is that something you want to do? Okay, Heidi and Dr. Zink.
Great. No, Margie, I appreciate that question and both of those. So the question about how high the numbers will go, that is yet to be determined. This is a novel coronavirus. Our population has not been exposed to it. Our epidemiologists estimate that maybe 7 to 10 times as many people actually have COVID in our state than the numbers actually represent. That's just because we aren't testing absolutely everyone. And it would probably take about 70% of the population to need to get COVID to really be able to stop the disease from moving between people. But that assumes long-lasting immunity. And unfortunately, some of the data coming out is showing that the immunity is not long-lasting. And part of the other reason why we're not moving towards kind of herd immunity. So again, the idea is to keep the numbers slow. We can keep a lot of businesses and people open and doing things, but being protected to minimize the extent of how many people get this disease so that we don't have the long-term side effects, we don't overwhelm our hospitals, and a third of Alaskans do have a CDC criteria for a high risk factor. So it's not like there's just a small group of us, and there are a lot of people who could be high risk. Regarding the seafood workers, great question. The seafood industry has put a ton of time and effort, and many communities have put a ton of time and effort into quarantining and testing very aggressively this population. Most of the seafood workers are in quarantine, and who manages them and where they stand really depends on the location, how much capacity they have there. We've asked all the seafood processing plants to identify areas to quarantine and isolate patients prior to the start of the season. So most are in kind of their barracks or their living conditions in that area. Sometimes they have been moved into Anchorage, and we've been watching those numbers closely. We have an entire team working with the seafood industry partners, and we also have our EPI team and a kind of a strike team that has gone into locations when we've had a series of cases, but cannot thank the communities enough, because some of the communities are doing a ton of testing to help support these industry workers and the industry for really changing their entire process to be able to quarantine these cases. I think we would be in a very different place right now if there wasn't a lot of time and effort spent on that early. Heidi, I don't know if there's anything else you want to add.
Thanks, Ann. No, you did a great summary. Honestly, I go back to the partnership with all of these seafood processing companies and the communities. There was a significant amount of work that went into developing these plans and processes February, March, and April, which has really helped us before the fishing season got started.
Thanks, guys.
Okay, we'll take our next question from Michael Armstrong at the Homer News.
Okay, thank you. Yeah, I have a question related to schools opening in the fall. If the spike continues, how realistic is it to think that we would be able to open the fall? Are there any metrics you're going to apply? What are you going to be looking at as we get closer to school opening to make sure we can do that, or possibly not do that? Thanks very much.
Michael, I'm going to use an overused term, and that's a very good question. And the reason I say that is we have Michael Johnson working with school district officials in the state, but also working with folks nationally to try and get a handle on this. You know, I'll just be very brief, but again, this is a once in a lifetime event. This is a pandemic. It's its own virus. You know, we understand measles, we understand smallpox, how to deal with those. And in the case of smallpox, eradicated that a long time ago. And measles, thank goodness, is being controlled through vaccinations. But we don't have the answer to that. You know, the previous question by Margie is a lot of these answers we just simply don't know. If we knew, we would state what it is we do know and how to get to that point. You know, we have some ideas. Some of these things seem to change every couple weeks. A lot of uncertainty, a lot of new information. We're gearing up in education for a couple different possibilities. We're gearing up for having students go back to school, as we always have. We're gearing up for different types of setup for some students to be there, some students to be there on another day. We're looking at distance delivery. We're trying to come up with a number of contingencies, working with our school districts and those school boards and superintendents and staff, trying to come up with something that we certainly can make work. There are some, if you read the information, that believe that all students should go back, and I'm talking health professionals and some in the science world, because it appears that younger folks, again, don't have the illnesses associated with the infection. We simply don't have the answer. We're planning on school happening this fall in the state of Alaska. We're gonna cross that bridge when we come to it. We're gonna make decisions as soon as we can, but we're still having those conversations as to what this is going to look like. Again, Alaska is a huge state. It's very diverse, different size schools, communities, et cetera. And we're going to work with those communities to come up with an approach that works best for them.
Let's go to Ketchikan for a question from Sam Stockbridge at the Ketchikan Daily News.
Hi, Governor. This is Sam Stockbridge. I'm curious. So here in the city of Ketchikan, there's going to be consideration of an ordinance that would require masks in public spaces, similar to Anchorage, the municipality of Anchorage's mandate. Given the memo from the Attorney General that was released on Friday, are there plans to impose a similar exemption for state buildings and state employees if the mandate does go through here in Ketchikan?
Well, we would look forward to a conversation with Ketchikan. We're in communication with municipalities throughout the state, leaders of other entities as well, business leaders, leaders of our Alaska Native communities, et cetera. So if folks are looking at doing certain approaches to health, certain health advisories, looking at potential health mandates, we would invite a conversation with them because, again, we want to just share information as to what they're seeing from a scientific point of view, from a numbers point of view, and hopefully we're seeing the same thing, which would have us say that a certain approach is a good idea or maybe not. But again, I'm working with communities, individual communities, a very diverse state. We have some of our smaller communities that we're going to continue to work with in terms of limiting non-essential travel in. We'd love to have the conversation with Ketchikan and every other town in the state to see what they're thinking and why they're thinking what they're thinking. But we're going to do our best to support all of our communities and lock arms like we have been to try and get through this process, this pandemic. And so again, we'll look forward to having a conversation with Ketchikan and other communities as to what they're looking at doing and have the discussion with them.
Okay, thanks for that question, Sam. Now let's go to Jason Lee at KSRM Radio in Kenai.
Thanks so much. Governor, you mentioned Senate Bill 241 expiring tomorrow. So for renters who have fallen so far behind that they're temporarily beyond repair financially, what's the state's guidance for what their next step should be? If they're still in need of help because of COVID, now what do they do exactly?
That's a great question. And what we'll do is we'll get something up on our website. We'll field questions individually from renters on that website. We'll get the information out to them. I'm not, I can't answer that right now. What advice I would give folks. Certainly, we don't know how long this whole process is going to work. This pandemic literally has disrupted everybody's lives. And we're writing a playbook. We're trying to get out as far as we can in front, but we're writing a playbook to try and deal with some of these things. So that's a great question. We'll try and get some answers up on our website so we can help folks with that particular issue.
Thank you, Governor.
All right, let's go back to R.B. Smith at the Nome Nugget.
Hi, thanks for getting back to me. So my question is about the AK Cares program. And Nome, like a lot of places, relies heavily on tourism in the summer, especially from cruise ships. But a lot of local business owners, maybe native artists who sell their artwork or day tour guides, operate their businesses seasonally and incidentally and don't have business licenses. So they can't apply to the general AK Cares fund. So I just wanted to ask, what, if any, allowance is there in the AK Cares program at the state level to give relief to those businesses? And if there isn't, what can those business owners expect to do? Thank you.
Yeah, so these are businesses I want to make sure that don't have business licenses, maybe small seasonal businesses. Commissioner Anderson, has this been an issue that has come up, and has there been discussion on this particular type of business?
Thank you, Governor. I have not heard about this issue with the small cross people that are providing, small one-off type services and goods to the tourist industries and others. But what I would recommend, because it is very clear in our guidelines for the CARES funds for small businesses, that business licenses are required. But within the community of Nome, they will be receiving community grants that they could then utilize to help the people in their areas to provide some small business relief with those grant funds. And I want to make sure that communities and people that live in these communities are well aware that these funds that go to the communities are not restricted to the program guidelines that we have with the Alaska Cares Small Business Relief Funds that we are administering. So they have more latitude to provide additional broader guidelines, and I would encourage them to do so. So I think that would probably be the quickest, fastest avenue for these entities to look for some additional funds. Thank you.
Thanks, Commissioner.
Okay, now let's go to Fairbanks for a question from Aaron McGordy at the Fairbanks Daily News Miner.
Hi, thank you. This question is for the governor. Is there any plan to change any of the mandates, for example, with regard to the size of public gatherings? I know that there is some concern with regard to some shows that have happened here in Seward that have resulted in possible exposure for people there. Are you planning on making any changes to previous mandates with the spike in cases?
Yeah, good question. So, again, we are, at this point, we are recommending the social distancing, as we always have. We're going to watch the numbers, the ICU count, the positivity count, the hospitalization, et cetera. We're going to watch those. So we're going to watch the numbers of positive cases, and we're going to try and project out. We're going to do this on a daily basis. If, again, we've said all along, if we need to change our protocols, if we need to change our advisors and approaches, we'll do that. If we see something that we believe is going to result in growth in a certain area, whether it's folks heading to the hospital, folks in ICU, et cetera. So we don't have anything planned at this moment, but those tools are always available if we need to, and we'll keep an eye on that, and we'll let the public know if there's going to be changes. We're going to let the public, keep the public updated as to the numbers. Go to the website every day, and we'll most likely have another press conference here beginning of next week just to see how things went over the weekend.
Okay, thanks for that question, Aaron. We have one more question from Fairbanks. This one comes from Aaron Walling at KXTF.
Hi, this question is for Commissioner Ledbetter. With the numbers of unemployment and also jobs being added, one of the areas in the state is tourism that has been hit hard. Is there any areas that you guys are targeting in terms of trying to add more jobs to as to help alleviate the pressure of losing tourism?
That's an excellent question. Thank you so much for that. I would say off the top, the healthcare industry is in need of individuals. And so we're seeing the unemployment rate in that particular sector go down because we're not having as many folks applying for unemployment insurance in that area. And so we're trying to help people transition to other types of industries and employment. But I would say contact your local job center, and there's more information available there.
Thanks, Commissioner.
Thank you, Commissioner. Now we're going to go to Juneau, and we'll start with state government reporter James Brooks at the Anchorage Daily News.
Good evening, Governor. The economic recession seems likely to continue for a while longer here in Alaska, but as you said, elements of SB 241 are expiring today and later this year. So what additional measures are you planning to address the recession?
The session? I want to make sure I understood what you were saying, James. The session you said?
Could you rephrase
yes, the economic.
Oh, recession. I see what you're saying. Again, we're going to look at what programs, where our programs are at right now. It's difficult to plan out several months in advance because of the nature of this pandemic and what it has done to the economy. We're anticipating, as we get into the fall time past the summer season, that we're going to know more about how damaging this was to businesses and to the economy. The federal government is talking about a potential fourth package, another package. We are trying to have conversations to understand what that may look like. Again, we're going to take a look at this. We're going to try and get out ahead of it as far as we can and as much as we possibly can. And we'll reassess what impacts our programs that we currently have in place that we're delivering to Alaskans and Alaskan businesses, what impacts they're having. But right now, it's difficult to forecast. There are folks that agree with what you said, James, that we're going to struggle for some time. And we don't know what this is going to look like in late summer and fall, but we're going to try and anticipate that we may need to do something. We'll have that discussion with the feds, and we'll have that discussion with our legislature, too, if necessary.
Okay, now let's go to Peter Siegel at the Juneau Empire.
Thanks. This is a question for Dr. Zink. Doctor, earlier in the press conference, you said that we've demonstrated the ability that we can limit quick spread of the virus while still having businesses open. I was just wondering what a quick spread of the virus would look like in that context, and are there specific numbers?
Yeah, it's a great question. So with that first kind of wave, businesses shut down, and that was very, very helpful. But we are seeing in numerous states and other places around the world that if we can get a low number of cases, and if we're able to keep people 6 feet apart, wearing a mask and hand washing, we can do a really good job of keeping the virus from spreading. So for example, like if you look at many of the hospitals that are caring for a lot of COVID patients, they're able to keep their healthcare workers from getting the disease by wearing good masks, protection, hand washing, and we've learned a lot about the disease in the process. We also see businesses where, a hairdresser wears a mask, and even though she ends up turning out positive, she doesn't give it to the 140 people that she takes care of because she was wearing a mask during that time. And so we are seeing more and more examples across the United States of where by wearing a mask, staying 6 feet apart, washing our hands, we can really minimize that transmission. What a quick spread is really that R0 value, how many people are getting it from one person to another person, and we get into that exponential growth phase. That's what we're really seeing in Arizona right now. We're starting to see it in Texas as well, a little bit in Florida, but where you go from just not having one case to another case, but you're seeing one case results in 2.5, 3 cases and can very quickly spread. We also saw that on some of the cruise ships early on in this process. We continue to track that number. It's a harder number to track in Alaska, given our low population and our geographic spread, but is an important number for us to be looking at closely. Also, remember that about 80 to 85% of people in a household can get COVID if you don't really isolate that person. And that's part of the reason why to get tested early and to isolate people who have the disease so that they don't spread it to their loved ones.
Okay, thank you, Doctor. We have one more question from Juneau. Let's go to Andrew Kitcheman at KTOO.
Thanks, Jeff. I have a question for Dr. Zink or Heidi Hedberg. Department of Health and Social Services officials said in late May that they were aiming to increase the number of people doing contact tracing from roughly 140 to 500. The department gave the same numbers last week after a month in which the amount of tracing needed increased. Are you confident that the state is able to do the contact tracing it needs now and will need in the future?
So if we can go to Heidi on that.
Yeah, thanks. So I'll start, and happy if Ann or the governor or commissioner want to join in. So what we have seen with the contact tracing is working through bringing on a brand new IT system, which is called ComCare. That did take more time, and we are working with a lot of our partner agencies. And so working through those agreements to make sure that there's clear expectations and understanding on the roles and responsibilities between the Department of Health and Social Services and our partner organizations. That has taken more time over the course of the last few weeks than what we had originally anticipated. We seem to go really fast, and then we run into some stalling points, and then we continue to kind of progress further. So we did get a lot of those agreements signed Friday and yesterday. And so what we're looking for is to onboard and make sure that our contact tracers are trained, and that is most important, and that we're not rushing the process.
Okay, thank you, Heidi. We're going to wrap things up with 6 questions from the Anchorage area, and we'll take the first one from Daniela Rivera at KTVA.
Hi, thank you. Governor, I'm wondering, according to Dr. Zink and data from across the country, going to bars is a high-risk activity. The governor of Texas says if he could redo one thing in hindsight, he would have slowed the reopening of bars there. based on what we're seeing here in Alaska, are you considering reinforcing restrictions in bars at all here? And if so, what might that look like?
Yeah, a very good question. Similar to a question that was asked earlier as to what we may do in the future, in the near future, midterm. We're going to look at these numbers again. We're going to take these numbers apart, as we do almost every day, to find out what twists and turns potentially this virus is going to take. Looking at the numbers, where they are, where they're at. Again, looking at our bed counts, looking at all the metrics that we have. Based upon that, we will make decisions on advisories, protocols, and other steps if we need to. Everything is on the table to fight a pandemic. There's just no doubt about that. But again, what we have found over the past several months, it's almost like squeezing one of those long balloons. As you think you can press on one side, it's manifested somewhere else in the system. And so what we're finding, and what they're finding in the lower 48 too, is, and I'm not talking about bars per se, but just actions that we take, thinking we can try and head off this virus, contain this virus, somehow mitigate this virus. What we find is that there are other health considerations that we then have to be concerned about, or emotional mental health issues, or as we plainly see, economic issues. And so what hasn't changed is that we know that if we stay apart from each other, we minimize the spread. And I know that there are a number of establishments that are trying to have outdoor seating. There are a number of establishments that are still open for delivery and pickup. And with the weather the way it's going to be over the next week or two, as you recall last year, we had a very hot summer, very dry summer for most of June and most of July. This is an opportunity for folks to go outside or be outside. But again, we're going to watch everything, and we'll make what we believe are appropriate decisions. We have pretty good statistics right now. Yes, the numbers have gone up. There is no doubt. And when folks say, well, does that concern you? We're watching this constantly. And everything we've been looking at since day one, even before we got the first virus, concerns us because it's a new thing. But again, Danielle, we'll take a look at this. We'll act appropriately on behalf of Alaskans. It's difficult to answer until we really examine these numbers and see where they're going to go here over the next few days.
And let's take a question from Kavitha George at Alaska Public Media.
Hi, my question is for the governor. You and Dr. Zink have both continually advocated for masks as an effective way to reduce the spread of the virus. So could you walk me through the intent behind preempting Anchorage's mask order for state buildings?
Well, we've always been advocating for masks. We do a lot of telework within the state buildings. In other words, we have people home working. We advocate for distancing. We advocate for wearing masks where appropriate. We advocate, again, trying not to congregate in large groups, because these are the things we know that are really tools to help mitigate the spread. And so we've been doing this in the state buildings. We've got a system, we have a ferry system in Southeast where folks are wearing masks because of the closed-in nature of the work there inside of these boats. And so we're going to continue to look at everything, as I've mentioned, and we'll make appropriate decisions. But right now, as we had for the past several months, it was Alaskans wanting to make sure that we work together and willing to work together that got us to the point where we are today, where we have some of the best statistics, and I don't think anyone can argue with that. We'll keep an eye on things and see if things keep increasing, and not just the actual counts in the positivity count, but also in these bed counts. And so we're going to take a look at everything. We're going to keep monitoring things, and we'll adjust where we need to.
Now we have two questions from the Anchorage Daily News. Let's take the first one from Zaz Hollander.
Thank you, Jeff. I had a really quick clarifying question for Dr. Zink. I was having a hard time hearing you, Dr. Zink. Did you say that there were outbreaks associated with 7 bars? And then I also have a question for the governor.
Yeah, it's a great question. We have 7 cases that were positive while they were at bars, so not outbreaks associated with that. So we are investigating those cases right now.
So 7 individual cases.
Okay, thank you.
7 individual cases.
7 individual cases, correct.
Thank you. And,
at bars during the infectious period.
Okay. And Governor, you talked about with this weekend, the holiday weekend coming up, and you said this several times that you trust Alaskans will do the right thing. A number of communities have canceled their 4th of July celebrations, but there are also a number of kind of alternate events that are in the works. What message do you have for people who are organizing these events, some of which include events like, parades that might be hard to socially distance at?
Yeah, very good question. Again, I wear a mask when I'm going to go to the store. I will social distance. We've changed my schedule. I do a lot of audio. I do a lot of audio, visual, video conferencing. I work hard at, if I'm going to meet people and I have to meet them in person, spreading them out, for example, in the conference room. Wash my hands a lot. This is the same advice I would give everybody coming up on this weekend. I've already had people tell me they're going to have barbecues at their place. And with the hot weather, they're going to be outside, which is good. Try and have as much of this outside as possible. They've also said to me that they are going to spread out. They are going to have seating that's going to spread out. And they said they're doing this because they have family members that are older, and they just want to contribute to the cause. For folks that are going to be in large congregate groups, it's just a fact. When you get closer together, you increase your risk for spreading this virus. It's just a fact. And my advice would be, if you can minimize through your actions, minimize the spread, hand washing, distance, that sort of thing. That's my advice. I've changed my life. This thing is, make no doubt about it, this thing is a pain in the neck. This thing is like anything else we've had to deal with in our lifetimes. We don't know where it's going to go. Again, I don't want to be repetitive, but I think it's very important. The good news is we've established that children are not a target of this. Thank God. We've established that the vast majority of people, if they get infected, they either don't know it or show mild symptoms. That's a good thing. We do know it affects and impacts a segment of our population that we've described on numerous occasions. That's really, at this stage of the game, who we're looking out for. So anything we can do that helps mitigate the spread of this virus, we strongly urge Alaskans to do that.
Now let's go to Morgan Krakow at the Anchorage Daily News.
Thanks. I think this question is for probably both Dr. Wondering, given the long turnaround times for tests and the reportedly long lines at testing facilities, especially here in Anchorage, is the state considering limiting testing to conserve test kits in any areas? And also, how are those turnaround times affecting the state's ability to do contact tracing?
So I guess that would be a Heidi or Dr. Zink question.
Yeah, I'll take that one. It's a fantastic question. So we see a lot of variability in the turnaround times. So many of the urgent cares do point of care testing, and so you get it back in 15 minutes. Home tests, we see anywhere from 48 hours, 24 to 48 hours, so quick turnaround there. Some hospitals are able to do testing within 24, 48 hours. The state lab continues to be somewhere between 24 to 48 hours. There were some challenges with the initial travelers who came in getting those results back, but all of the lab testing is kept up. What we're finding is the commercial labs that are being sent out of state, there's a lot more variability there, particularly as cases surge in the lower 48. And so while a commercial site might have a wait of a day or two, it can suddenly surge to 6 or 8 days. As you mentioned, that can make contact tracing much, much harder because you're thinking about the infective period for a much bigger period of time. It also really impacts people's lives. They're waiting that whole time for that test to come back, and it's really important that we try to do everything we can to get that back as quickly as possible. At this time, we have no plans to restrict or limit testing. We continue to try to find ways to expand it. Our team was at the Lake Otis site today working on efficiencies and also looking at other places in combination with the Muni, who has a lot of cases right now and has been doing a lot of tremendous work, both contact tracing as well as continuing to talk about testing. We also have a lot of testing that has to happen associated with outbreaks, so really appreciate the community partners to be able to do that and move forward. One last thing, our lab director is retiring, so just a little public shout out to him for a ton of hard work that he's put into that. And Heidi and team are helping to make sure that transition is as smooth as possible. But the lab has stood up. Our lab can do over 2,000 tests a day. Many other state labs are in the hundreds of what they can do. So appreciate their partnership and also appreciate the governor's support and the state on making swabs and UVM. We continue to significantly rely on what we can produce here in the state rather than on the market, and that's been tremendously useful to being able to get tests and being able to do outbreak investigations very quickly. So thank you.
Yeah, that's a good point. We talked early on about trying to find swabs and trying to get orders for swabs, and we turned to industries here in the state of Alaska, and they're turning out thousands of swabs. Reagent was a problem. That's part of the test kit. We got reagent being produced here in the state of Alaska. So we're producing our test kits here in the state of Alaska. This is a testament to the ingenuity, flexibility, and commitment by these businesses, as well as distilleries that are helping us with our hand sanitizers. This is an example, once again, of Alaskans pulling together. Alaska is not known as a manufacturing state, but in our time of need, when we, to some extent, have to rely on ourselves to make sure that we have what we need here, Alaskans are stepping up, and that's what we're talking about.
Okay, thanks, Governor. We're down to our last two questions for the evening. We'll start with Jill Burke at KTUU.
Hi, thank you. I have a follow-up on the question about testing and variability. It's a little bit difficult to hear, so I apologize if you covered this, but could you just go over again why we see so much variability between what the state lab can do in terms of its turnaround time and then maybe some of the labs that are out of state where, folks were expecting maybe a lab test within 48 hours and some of them are going on 5 days, 7 days, 8 days, still waiting to hear, what the result is.
So, Doc?
Yes, no, I appreciate that question. And we do see a lot of variability around time. We continue to see just tremendous variability in the supplies and reagents. Depends on where it's being sent. So there are point of care tests that can be done 15, 20 minutes at many of the urgent cares and some of the hospitals around the state. When we send lab tests off to the commercial labs, we're really dependent on what's happening nationally. So it may come back in 24 hours. It may take much longer. And so we continue to see that as a challenge. We are seeing a lot more directed home tests, including at least 3 tests now that you can order online and be able to do the swab yourself. And you get the results directly at home. So there's a lot more commercial availability, and those we're seeing better turnaround time. I think we will continue to see a lot of variability in the testing landscape for the next few months. We'll think we have reagents for one machine, and suddenly those will go in low supply because of other demands in the lower 48, and so we'll be moving to another one. We're encouraging all communities to have a broad range of testing options and encourage Alaskans to know the different options in their community. There is free testing setting up in the Fairbanks area that will be tomorrow, Eagle River, Anchorage. We've tried to remove any barrier, including needing physician notes prior to that to try to make it as easy as possible and appreciate Alaskans' patience in what is a very rapidly changing landscape in testing.
Okay. And for our last question, let's get it from Patrick Enslow at KTUU.
So my question is, states that have mask mandates, they've seen COVID cases fall, those without it, they've seen surging cases. The governor has said you want to follow the data. I guess it comes down to just why not institute a statewide mask mandate?
So it was hard to hear what you said, but I think you said states that have mask mandates have falling cases. I want to make sure that's what I heard, Patrick.
Yeah.
Okay. I don't know if I necessarily agree with that. We're looking at those numbers as well. We're looking at state numbers as well. And you had low numbers in California. You've got low numbers in. You had no low numbers in California. That's going up. Los Angeles County, for example, is taking off. I think you'll find that there's a number of states and counties that have had mask mandates. It's increasing. I think what in some of those places. Now, I don't want to make a connection, a nexus between mask wearing and increased cases. The evidence would appear that the opposite is what would happen, because you're limiting your projections and your spread. We're looking at all of our numbers. We're looking at all of our data. Regardless of whether a state has masks or doesn't, Alaska's data that got us, and the actions that got us to this point, that support the data that we have, the low numbers and many of the metrics that we've talked about, are things for us to look at. As we move forward, we are encouraging people to wear masks. We are encouraging people to wear masks. As I mentioned, I'm wearing a mask when I go out to a store, if I have a meeting in close proximity with others. And I plan personally, myself, to make sure that I have the mask with me all the time. I've got the mask on where I need to. I'm not going to wear a mask when I'm walking our dogs, or I'm not going to wear a mask, obviously, when I'm outside doing things. But your point is well understood. These are just additional steps to help mitigate this virus. I encourage all Alaskans to do everything we can to mitigate the virus, including when you go to a store or you're especially going indoors, to help limit the projection of this spread. I guess that's the last question. So anyway, I want to thank folks for tuning in. I want to thank the reporters for the questions. This is very important for the people of Alaska to kind of get a feel and understand where things are going, where they've been, where we think they're going to go. There's a lot of unknowns with this virus, a lot of unknowns. We've learned a lot. I've mentioned some of those things over again with regard to impacts on children, impacts on vulnerable Alaskans. We talked about the economy. We talked about the overall health of society. We talked about when you take an action over here, what does it look like over here? Does it have a negative impact? Is the action you took to mitigate the virus over here more damaging in some respects over there? All of these things we're constantly weighing. We're constantly having discussions. This is not boasting. This is not confidence. It's just right now our numbers are still pretty good when we're talking about positivity rates, and we're talking about testing rates, and we're talking about hospitalization and ventilator use. Alaska's in very good shape compared to other locales. We are watching our numbers. We knew our numbers would go up. We know this is a highly contagious virus. We do know it's not as lethal to the general population. So these are things we know. We're not sure what's going to happen in a month or 2 months. We're not sure if this virus is going to lose some of its contagious factor. We don't know if this is going to become less of a problem for those in the vulnerable class. We don't know if in a month they're going to come up with a treatment for those that get sick that can help minimize the health issues. We don't know that. What we do know is we've got a lot of balls in the air that we're juggling with this pandemic. The health of Alaskans, the societal issues we have to deal with, the economic issues that we have to deal with, the education issues that we're going to have to deal with. We understand this. And like every other state, and like every other country on the planet that's dealing with this, we're all trying to learn as quickly as possible and make the best decisions that we can. And I would ask folks, I would ask people that I know that we're tired of this, that we're so, as somebody said to me, we are so done with this whole virus thing. I understand that. I'm so done with the virus thing, to be perfectly honest with you, but I know that I can't stop doing some of the things that we have to do to get us through, hopefully to a point here sooner than later, where this thing can be treated and then hopefully eradicated through a vaccination. We can't stop working on that. We have to continue to work on that. So I understand folks that are done with this. I understand folks that really don't want to wear a mask. I understand folks that are wearing a mask and may know people that are health impaired and want to do their part. I get that. There's been a lot of division going on in this country here lately. And Alaska has been spared a lot of this. And I would just ask Alaskans that we become, as this thing gets old and irritating, as this virus is really being a pain in the neck, as I said earlier, that we still work together to the best extent that we can with our fellow Alaskans, that we still say, yeah, all right, I'm going to go to the store, I'll throw the dang mask on, that we still do our best to socially distance. We'd like to have a meeting. Well, do we have to do it in person, or can we do it online? Those are some of the things that have really disrupted our lives. Those are some of the things, unfortunately, that'll keep our numbers down until we can get a treatment here, hopefully sooner than later, and a vaccination. So all I can do is ask that Alaskans continue to do what we have done to get us to this point. We've done a tremendous job to get us to this point. We have our economy open, which we have to do. There's no precedent anywhere that I can find or anyone else can find in which you have a modern civilization existing without an economy functioning. It just doesn't work. We have folks that want to do their best to continue society as it has been, because quite frankly, it works for most of us. But some things we can't do like we once did, or we have to do them a little differently. I understand that. It's a pain. It's not something I want to do or you want to do. But all we can do is we'll look at the numbers next week and the week after. And all I can say is our behaviors are the only thing that is going to help mitigate this spread. There's no vaccination. There's no chemicals at this point. There's no medicine at this point that does that. It's just us. And it's us in our individual and collective actions. And so, when you see somebody out there with a mask, just tell yourself that there's a reason they have a mask on. They want to help out. If you see somebody out there without a mask, look at the setting that the folks are in. Look at the setting. I mean, if they're walking down the street or they're out walking their dog and they're outdoors, maybe they don't need a mask at that point. But again, we're asking all of us to work together. This is not easy. We've done a great job. I want to be able to come back next week and be able to report to you numbers that look pretty good. And we'll see where this goes. We'll do our best. We'll work together. We'll keep you informed. We'll answer your questions. And we're going to work together to get through this like we said in the beginning. So with that, Alaska, I want you to obviously enjoy the coming week. My understanding is the weather is going to be amazing. Independence Day, 4th of July, fantastic holiday. It's a fantastic holiday to get together, a little bit of a distance, but get together nonetheless. Be safe, enjoy yourself. We'll get back to you next week. We'll have another press conference. We'll update folks as to where we're at. But I am as confident as I ever was that by working together, we're going to get through this. So with that, Alaska, stay safe and have a great weekend. Thank you.